Turning to Sudan, the Office for the Coordination of Humanitarian Affairs says that despite the extremely dangerous operating environment, we and our partners continue to deliver life-saving assistance wherever access permits. In Tawila, which is hosting hundreds of thousands of people who fled attacks in and around El Fasher, UNICEF reports that our humanitarian partners have recently reached more than 12,000 people who recently arrived there with safe water, while chlorination activities at 10 public water stations now serve 45,000 people daily. Given the huge scale of needs and severe funding shortfalls, we urge donors to step up their support for the humanitarian response urgently. This aid comes at a critical time. According to the Famine Review Committee, famine conditions are occurring in El Fasher in North Darfur and Kadugli in South Kordofan, towns largely cut off by conflict from commercial supplies and humanitarian assistance. The Food and Agriculture Organization, the World Food Programme, and UNICEF say that across all critically affected regions, the drivers of hunger are clear: conflict, displacement, and blocked humanitarian access. In Tawila, mobile health and nutrition clinics continue to provide services for new arrivals, including screening children under 5 for malnutrition and admitting severe cases to outpatient therapeutic programs. While we and our partners are scaling up therapeutic feeding and vitamin supplementation programs, while efforts continue to ensure safe deliveries and emergency care for pregnant women through mobile clinics. Meanwhile, OCHA warns that violence continues to intensify across North Darfur State. On Sunday, multiple air and drone strikes were reported across the areas of El Fasher, Tina, and Wana Mountain. Local sources continue to report civilian casualties, but these remain unverified due to limited access and the difficulty of communicating with people in the affected areas. Yesterday, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, condemned continued attacks on healthcare in Sudan after the Kernoi Pediatric and Maternity Hospital in North Darfur was struck, resulting in at least 4 deaths, including children, and 3 injuries. He stressed that such attacks on healthcare must stop everywhere. The security situation in the Kordofan region continues to worsen. Local sources report that at least 40 civilians were killed and dozens injured yesterday in an attack on a funeral gathering in El Obeid, the capital of North Kordofan State. Once again, we call for an immediate cessation of hostilities and for all parties to protect civilians and respect international humanitarian law. It also urges all sides to ensure safe and unimpeded passage for humanitarian workers and relief supplies to reach all people in need.